Hello, and welcome to the Thyroid Warrior podcast. I'm Ebony, and I'm here as your wellness facilitator. I'm going to be sharing my experiences in managing Hashimoto's disease. I really hope that it'll help you on your personal journey. Keep in mind, however, this does not substitute for medical advice. It is only for your information and motivational purposes only. Now, let's get started. Hello, friends. I am hoping that you're enjoying just digging deep into the nutritional aspects of what can really and truly help our bodies and nourish us. And this month, I just want to talk a little bit about some of the conditions that can also affect us as it relates to having a thyroid condition. So I'm giving you a heads up. So today we're going to talk all about blood sugar and diabetes. And because it is Heart Health Month, next week we're going to be talking about that very thing. And it's all about your heart, your blood pressure, and what can happen when you're experiencing things as it relates to just staying on top of monitoring your symptoms. And lastly, we're actually going to end the month talking about vaginal health, as well as just doing a recap of everything that we've covered. So I really and truly hope that you've enjoyed this deep dive, but I also have a couple of things to remind you about, and that is at the end of this series, I am going to provide you guys with my nutrition guide that's going to have a summary of everything that we've covered. And to get that, go ahead and go to joyfulebony.com/email so that you can get on my email list to be able to get that guide for free. And also, we're coming up on 100 episodes of the Thyroid Warrior podcast, and I really want to make sure that you guys have voted on where I have my live event. And you can vote by going to joyfulebony.com/live event. Now, let's talk all about diabetes and blood sugar. Now, there are a couple of things to consider when it comes to understanding blood sugar. So let's just start there, because in a lot of cases, what I've noticed when I've talked to other people that have thyroid conditions, usually high blood sugar is the culprit and the issue, as well as diabetes. So I wanted to really dive deep into this topic as well, because it's something that, while it hasn't necessarily affected me, diabetes runs in my family, and I definitely wanted to talk more about it and have some conversations with you all. So let's start at the very, very beginning and just understanding how that whole sugar component even gets into our body. And as you know, when you eat, the process of digestion starts in your mouth. And once you've actually swallowed and the food has gone down your esophagus into your stomach, it then goes into your digestive tract. In that process, your digestive system is going to break down the starches and the protein to turn it into amino acids and all of the basic building blocks that our body needs to function. But in addition, it is going to break down anything that it can into sugar. And that is going to enter our circulatory system, or our bloodstream. And what then happens is, under normal circumstances, that sugar is stored in our muscles. But as it relates to blood sugar, it kind of needs an invitation. So when you think about it, the way that blood sugar gets into our bodies or the cells is through insulin. So when you have your insulin that attaches to that blood sugar molecular particles, it's going to have kind of a chemical reaction, but it's happening through the process of enzymes, and that kind of shuttles the blood sugar into your cells. Now, when that process happens normally, it's a beautiful relationship. But when you have an instance in which you have issues with your body and how the insulin works with the sugar to actually have it enter your system, that's when bad things happen. If you don't have insulin working properly, you can't really get that sugar to enter your muscles and your system effectively. And so you develop this abundance of blood sugar in your bloodstream. With that buildup of blood sugar, it's going to start the process of actually damaging your internal organs. And that's when we have to start the process of looking at different types of diabetes. And you have type 1, and for most of us, we know this as juvenile diabetes, but unfortunately, over time, as doctors and researchers have started to realize that it's not necessarily just affecting people when they're younger. Type 1 diabetes is also considered an autoimmune disorder, and during the actual process, what's happening is you have what are called beta cells in your pancreas. And those cells are responsible for actually producing insulin. But in type 1 diabetes, those cells are destroyed. And what we commonly hear about is type 2 diabetes. And a lot of times that is developed in adulthood, though not always. But typically when you have type 2 diabetes present itself, the body isn't actually able to use that insulin. And we know that the glucose can't get into our cells. But what we're also noticing about type 2 diabetes is that when you think about how insulin shuttles in that blood glucose, that process doesn't work as well. It's jammed somehow. Something is blocking your blood glucose from entering your cells, and that process is called insulin resistance. And what we know about type 2 diabetes is that a lot of times what can put people at a risk for developing it is when you're overweight or obese and inactive. That is when you have to make sure that you're getting regular screenings to be sure that your blood sugar levels aren't spiking. Now, here's the other issue. Sometimes we also hear about prediabetes, and that's when you have high blood sugar levels, but it's not exactly high enough to be considered diabetes. Now, when it comes to a range for diabetes, there are certain numbers that you want to make sure you're within. For example, when you're considered normal, you want to make sure that your blood sugar level is less than 100 milligrams per deciliter. As it relates to prediabetes, that's when your blood sugar level is going to be a little higher. And that range is going to be between 100 and 125 milligrams per deciliter. And lastly, when you think about having an onset of diabetes, that is when your blood sugar is going to be 126 milligrams per deciliter or higher. And the same thing kind of applies for your hemoglobin A1C levels. So when you're looking at this particular blood test, what's going to happen is when you're in the range or when you're considered normal, your hemoglobin A1C is going to be less than 6.5%. If you're pre-diabetic, it's going to be greater than 6.5, but less than 7%. And finally, when you're diabetic, your hemoglobin A1C levels are going to be greater than 7%. And the biggest thing to think about when it comes to diabetes is that there are risk factors related to this. For example, if you are someone that has let's say, an aunt or someone that is a first degree relative, for example, with diabetes, when you are African American, Hispanic, Asian, Native American, or Pacific Islander, you're also at a higher risk of developing diabetes. If you're 45 years of age or older, if you've had gestational diabetes, or if you delivered a baby that was greater than 9 pounds, if you're not active, if you're overweight or obese, if you have high blood pressure, or if you're low cholesterol, meaning the good, which is your HDL, if that number is not high. So those are some of the things that you want to think about when it comes to your risk factors as it relates to diabetes. So one of the questions that I have been given and things that I often look to ask my doctor, what should I be on the lookout for, is when you have frequent urination and it's not a urinary tract infection, when you're noticing that you're really thirsty or you're not really satisfied after eating, if you have fatigue, which I know is going to be difficult because you have that thyroid condition, but also issues with your vision being blurred, if you notice that your wounds aren't healing fast, if you're getting frequent infections or severe weight loss, and especially in type 1 diabetes, you're going to experience a lot of nausea and vomiting. And honestly, sometimes you might not even have symptoms. And I know that might make you want to just throw up your hands and be like, okay, well, what's the point then? But you really just want to stay vigilant. I'm not saying that you have to become a hypochondriac, but there are just certain things that you have to keep in mind when you have a thyroid condition, because remember, your endocrine system is really regulated by a lot of the hormones that is being produced by your thyroid gland. So you really want to make sure that you're staying on top of this. Now, the other thing that I want to mention is that what's the next steps? Like, what do you have to do when it comes to diabetes? Like, how do you diagnose it? What tests should you think about? And that is making sure that you can get a glucose tolerance test. And basically what happens is, especially if you've been pregnant or have had children, you may remember having to drink that sugar solution. And that's trying to see how your body's going to respond to the sugar. I know I've had it and I don't have any children, but in my earlier days of diagnosis, that's when we were trying to figure out if I in fact did have diabetes or if I was at risk for it. And that solution is not good at all, for the record. But you can also have your glucose test or your blood test done when you're fasting, and it's a blood test. And finally, you can have your hemoglobin A1C done. So you definitely want to make sure that you're talking to your doctor about those risk factors, about what runs in your family, because you'd rather be safe than sorry. Now, the key is making sure that you're educated about these things. And what you don't want to happen is have other diseases develop or conditions develop because you didn't pay attention to the symptoms of diabetes, for example, and you can be twice as likely to have a stroke, twice as likely to develop heart disease, to develop eye disease, kidney disease, and unfortunately, you may get to a point where you have to have a limb amputated, and we definitely do not want to get to that point. And I've worked with a lot of folks that have type 2 diabetes, and we have done a lot in terms of exercise and eating a balanced diet and really walking through why it's so important to really and truly focus on having a healthy lifestyle, because I've seen in many, many people, even separate from folks that I've worked with, who have been able to come off a lot of their insulin and other medications because they were very, very diligent about having a healthy lifestyle and really and truly working on eating foods that were going to fuel their bodies and help to minimize and or reduce their blood sugar levels. So I wanted to come and share those things with you because it's very, very important to me. It's something that is near and dear to my heart because, as I've said, I have family members, specifically aunts, who have diabetes, and I know how challenging that condition is to treat. And I just want to make sure that if you suspect or think that you may have symptoms of diabetes or you may in fact be pre-diabetic, you're definitely not alone. Definitely talk to your doctor about ways to reduce your chances of developing full-on diabetes. And if you have type 2 diabetes in particular, it's not difficult to prevent and or reverse type 2 diabetes. Type 1, unfortunately, it is considered an autoimmune disease, but you can manage it with a healthy lifestyle, exercise, and diet. And many of the things that I've talked about in previous episodes can definitely help you with that. So please let me know if you have any questions. I am on Joyful Ebony on all social media platforms, and you can always email me at hello@joyfulebony.com. And if you would like to work together to really and truly dive deep into a lot of the things that I've been talking about, you can go to joyfulebony.com/app. That is APP. And I will triage that information and set up a call with you. And with that, be happy, be whole, and be well. Take care. Okay, thyroid warriors, get out there and take things one step at a time. Remember, be great, reflect on your triumphs, and as always, be well. Take care.